Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough.
Hello.
We've been talking about dizziness and the different types, and I think today you're going to talk about motion sickness. And even saying that word makes me nauseated because I have that.
I do
horrible.
too. I do too. Actually, I went on a trip to Memphis a few weeks ago with some guys, and I said I can ride with you as long as I can sit in the front, because sitting in the back, all the different motions and signals that my brain gets causes me to be pretty motion sick. So if you've ever been motion sick, it makes you nauseated, your tummy don't feel good, and your head's kind of swimmy. It can last a while, yeah. And if you've never experienced it, imagine when you were a child on a merry-go-round, where they spin you around real quick, and then you try to get up and walk, and you're all over the place. So motion sickness can attack people in many different ways, and the main cause is that your brain's getting different signals from the different systems in our body: the vision system, the inner ear system, and the receptors throughout your skin, muscles, and joints. They're telling your brain different things. Like lots of times you'll be sitting in the car and you're just sitting there, but the car beside you kind of moves or something, and it gives a mismatch signal to your brain, and for a second you kind of get an imbalance or a dizziness because of that. So here at Fyzical, we have some very innovative equipment that we use. It's called a Virtualis system, and through that Virtualis system, your therapist will put you through a number of different tests, diagnostic tests, to determine where the mismatch is coming from. Is it vision? Is it the receptors in your body? Or is it the inner ear or the vestibular system? And by being able to pinpoint which one of those systems is affected, then we can develop a custom, personalized plan of care to help you to be able to overcome that. In addition to the testing, we also have a computerized dynamic posturography unit, which that's used in the testing component too, but there's a therapeutic component. And as you can see in this video, we're able to put goggles on our patients, and they're virtual reality goggles. And what that does is that's going to transport that patient to a whole new environment that will challenge their senses in a way that we can cause those senses to adapt to the signals that they're getting. And adaptation means, like, if you remember riding a bike and the handlebars were off, you kind of had to get used to that a minute. Like, you could keep riding, but your handlebars were off. Or like as an adult, if you're driving a car and your car is out of alignment, you kind of, it's not like this to stay straight, it's like this. So that's adaptation, okay? So through the exercise and activities, we train your brain to adapt. Another way that we do through our exercise and activities with our Virtualis system is an exercise based upon habituation. And habituation is a desensitization to the stimulus. So we expose you to the stimulus that causes the motion sickness over and over to a point within your tolerance. We don't make anyone vomit or anything like that, but within your tolerance, and over time, then your body will habituate to it. And sometimes we have to do exercises that teach a compensation or substitution when the other two don't work. So you have to use specific visual tactics to help you maintain your balance, like stay focused on one thing. Like the ice skaters, whenever they spin around real quick, or ballerinas, whatever, in the beginning they get dizzy And so they have to do exercises, and a part of that is focus, a part of that is habituation. But so anyway, we can teach you exercises and activities and substitutions to help you be able to overcome, manage, or manage. Either you overcome or you manage the symptoms that you have so that you can continue to do your normal activities of life. And okay, so that's what we do at Fyzical. So come and see us, and especially come and see us next week here on Louisiana Living. We will continue talking about dizziness. Thank you guys. Bye-bye.
Thank you.